It is Health Diary. My name is Gladys Gashanja and we're coming to you from the Radisson Blu Arboretum. Now, did you know that a sore throat can actually cause you a heart condition? Yes, an untreated and recurrent sore throat can actually lead to rheumatic fever, which subsequently can lead to rheumatic heart disease. That is our topic today, even as we meet somebody who is living with it. But before we get to it, here now is a fact of the matter. Rheumatic heart disease begins with a sore throat caused by the Streptococcus virus, which, if not effectively treated, causes rheumatic fever that begins to affect heart valves. The damaged heart valves narrow, resulting in decreased blood flow, or they may leak, causing blood flow in the wrong direction. Rheumatic fever can cause permanent damage to the heart if not adequately treated. In Kenya, rheumatic heart disease is the biggest killer among cardiovascular diseases, followed by congenital, then coronary heart diseases.
Kwa majina naitwa John Chege Kimodho. Mimi ndio baba ya huyu mtoto Joyce Wajiro, ambaye akona ugonjwa wa heart rheumatic disease. Wakati alipozaliwa siku ya kwanza, kufika nyumbani mtoto akaanza kuwa mgonjwa. Ile ugonjwa alianza nayo ilikuwa ni kama pimples kwa uso, zilikuwa zinatoka na usai. Tukawa tunaenda hospitali hii na hii na hii. Dakika ya mwisho tukaenda hapa Muthaiga wakampima na daktari akamuangalia. Ndivyo alituuliza kama tunajua huyu mtoto wetu akona shida. Mimi nikamwambia nikimsikiliza nasikiaga kama roho yake inapiga. Lakini nadhani sababu sijailea tena inakuwaga kawaida. Akaniambia hii si kawaida, ni very emergency. Huyo mtoto apelekwe Kenyatta. Sasa tulianza matibabu Kenyatta, na hapo ndio alipimwa, akapigwa picha, na hapo ndio alionekana kuna hiyo shida. Alikuwa na umri wa kitu kama miaka 4. Daktari alituambia kulingana ni mdogo sana, kwanza watampatia dawa ambayo atakuwa anadungwa kila mwisho wa mwezi. Nanunua hiyo dawa nampeleka anadungwa. Hiyo dawa hata si ya kumtibu, ni ya kuzuia tu ile magonjwa isimpate. Lakini hata kidungwa hivyo magonjwa bado inampataga. Shida ni kufugana mapua, homa ishi, saa ingine huwa na tonsils, unapata macho yake imefura, na mapua sana sana inatoa, tunaweza sema ni nose bleeding. Ni kweli NHF inatusaidia, na mimi nilikuwa nailipa hata saa hii niko nayo, lakini sionagi usaidizi wake. Sababu ile kadi nikienda nayo pale Kenyatta, hawachukui kadi ya NHF, wananiambia lazima mtoto awe ameraswa. Na ile pesa wananigharimu nikilinganisha na ya mtu ambaye ameraswa. Unapata mtu mwingine ameraswa siku 2, amechajiwa tuseme kama hata 10,000. Mimi naweza mpeleka nigharamiwe hata 15,000 na ni siku moja tu. Sasa mpaka na shida kadi ya NHF inisaidie. Ingekuwa inanisaidia kama inakuwa inagharamia gharama ya matibabu ya mtoto yote, hata kama hajaraswa. Kwa sasa hivi huyu mtoto wangu akona miaka 12 na sijawahi ona cardiologist yoyote.
So yes, today we look at rheumatic heart condition, and to help us do so, we have Samuel Arapsang living with rheumatic heart condition, and Dr. Yubrin Mora, who is an internist. And you said it is?
Internist is someone who is a specialist in internal medicine. As someone jokes, it's all in the middle of your body, things going on from your chest to your abdomen, but a lot of conditions including diabetes.
Okay, so today we're talking about the rheumatic heart condition, and it is said it's the sore throat that actually leads to the heart condition.
So here we are talking about an infection that starts as a sore throat. The body tries to fight it, And then subsequently you have the army of the body, which is the immunity, turning against its own. It turns against the tissues of the heart, turns against the tissues of the joints, skin, brain, kidney. But because today we are addressing rheumatic heart disease, which is a result of the infection, which we normally call as rheumatic fever, it can affect the pericardium, which is the outer lining of the heart, giving an inflammation. It can affect the myocardium, which is the muscle, the actual muscle structure of the heart, giving you a form of inflammation we call myocarditis. It can affect the inner layer of the heart, which is the endocardium. And in this case then, because the valves are made up of that layer, and then you have infection, or I mean not infection, but inflammation of the valves and subsequent dysfunction of those valves.
It's said to affect children between 5 and 15 years old, though it can also affect younger children. So why that age bracket?
5 to 15 is when a lot of those sore throat infections happen. It's the time that it's school-going children who are in overcrowded classrooms, especially in resource-restrained countries like ours, where we're having 40, 50 kids in the same classroom, and then this infection, because it's airborne, it moves from one child to the next.
So let's bring in Sam. 5 to 15 years, that is actually around the same age that you were diagnosed with rheumatic heart disease, right?
Yeah, that's true. It started at the age of around 6, and then as it progressed, that is when now it started developing into the fever, as the doctor says. But it was just the simple sore throat, which was frequent. Like even after treatment, after some time, I also get the same. Sometimes even it affects the vocal cords, the voice cords, so that I could not talk in a way that people can understand.
And were you the only sibling in your family that had that problem?
Yes.
So there's a genetic predisposition. It's not everyone who gets the sore throat who develops rheumatic heart disease. There's a familial link, yes, but again, not everyone in the family is likely to get it, but there's one person in the family who might get it. He talked about how he recalls getting a sore throat. A lot of the times, the patients will remember that I had a sore throat, then I had a rash, because normally it's not like, it's rare for you to just have one organ affected. So they'll remember that I had a sore throat, then subsequently I noted that I had a rash in my body, that's when the skin is infected, or my urine color changed, the kidney was affected, and then they'll report at that time I even had convulsions, because when the brain is affected, they have convulsions.
Did your parents notice that you were struggling with this sore throat or recurrent fever or flu?
Yes, they did, but you remember also that was some time back when we didn't have the resources as we have now. Because generally once one has been found to have that rheumatic fever, then which develops into rheumatic heart disease, then they usually give antibiotics, which injection like monthly, until it goes off completely. But in my case at that time, there was no such a thing. So it was like, once you feel better, you just continue.
He's talking about back in the day, but even today, there are some health practitioners who have missed the symptoms of a rheumatic fever.
Most importantly is the heart. What happens that they get this? They'll say that they have palpitations. They're feeling their heart is beating very fast, or they're having dizzy spells, or they are fainting, or their legs are swelling if their cardiac function or heart function is affected, so the pump fails to work well. But most of the time, the extreme cardiac or heart symptoms will not manifest earlier. This will come in later when the valves have become dysfunctional, and now subsequently you're having the pump failing because of either overload or too much fluid in the lungs.
And when we're talking about fainting, you experienced this when you were really young, right?
There was also the rashes. They were there. I did have rashes which could disappear after some time. But again, as it developed, there was the shortness of breath. You cannot do a lot of things because the moment you try to do something, the heart, because of the infection, struggles to beat, to pump the blood and the oxygen. And so if I happen to do a lot of work, that is when the heart goes faster, palpitating, then at that times I usually have a convulsion.
But remember, if the heart has failed, then now a patient will have symptoms of heart failure. And what are these symptoms? This will include swelling of the legs, swelling of the abdomen, inability to lie flat, or difficulty breathing when they're lying flat. They'll also sometimes have to wake up at night to gasp for air, and their hearts are beating so fast and their body just becomes puffy and swollen up.
All right, now heart damage from rheumatic fever might not show up for years. What actually suppresses it for that long?
How soon the disease progresses, how fast it progresses, how severe someone presents depends on how damaged the valves are. Yeah, and that can vary from one patient to the next, and it can also vary depending on how frequent, on how many episodes of rheumatic fever someone has suffered, because you can suffer recurrent episodes, or you can be treated, but you're treated suboptimally. Like, yes, you go with a sore throat, you're given antibiotics, but then what happens? You're not treated optimally because either the dose was small or you didn't complete the duration that you're supposed to do to take the antibiotics for.
There are other environmental factors that I'd like you to touch on, which would probably inform why we're seeing more and more cases of rheumatic heart disease. Is there a certain diagnostic test that can rule out rheumatic fever or separate rheumatic fever from the usual flu so that we stop the cases moving on to rheumatic heart disease?
Yes, it's called an ASOT test that we used to do. But right now, the best diagnostic yield is to just you taking a swab of the throat and the infection and growing and identifying that particular bacteria that does cause the result to rheumatic fever. Most importantly, it's just make sure when someone has a sore throat, it's identified, because when we see an inclination towards a bacterial infection, then because we don't tend to just go and swab everyone and try and see is it group A strep, beta strep. We just want to make sure that this is a bacterial infection. We need to treat it and treat it optimally, yeah, especially in children and in patients who are in the risk factor group, in that risk factor of getting rheumatic fever.
What are some of the circumstances do you think you grew up in that probably fueled you getting the heart disease?
The real problem was to do with me personally, because I usually like playing outside, mostly sometimes in the rain, and that is how I developed those colds associated with the sore throat.
The other factors would include ventilation, because remember, let's just assume you went to a village in Wajir, okay? They have a small manyatta that the family of 7 sleeps in. It's partitioned, so there's one tiny window, so there's poor ventilation in the room. So if one child got the sore throat, the rest would get it, because this is an airborne disease. But again, even science has shown that this age that is at risk is more prone because of the socio-economic status. If you move to the West, you realize that the geographic distribution of rheumatic fever, rheumatic valvular heart disease, these guys are seeing this going away because of all the revolution they had. They had this condition earlier on in the Industrial Revolution when they were having the living conditions that we have now in Africa. And as earlier on I mentioned to you, Gladys, that rheumatic heart disease, rheumatic fever, rheumatic valvular heart disease is a health systems disease. Because it means if we are not putting the right measures to take care of our children earlier, we are seeing this disease still showing up in adulthood, in our young women during screening when they are pregnant. And if we take care of the source, then we take care of the effects downstream.
Okay. What was the treatment plan for you?
From what they found out was that the valve was already damaged. And so to continue with antibiotics, hopefully there was going to be some changes. So I was given, I was prescribed penicillin, which I took, but there was no change. So that when I was now around 20 years, almost 19 there, that is when again there was some American doctors who were coming here and cardiologists. So because of the condition which they had my file there at Kenyatta, they called me. And these doctors now, because I guess they were familiar with the case, they say, okay, the case can be treated, but not locally at that time.
And what was this option of treatment? Surgery?
It was surgery, yeah. It was like now with the valves, since they are completely damaged, it has to be removed so that you get prosthetic one that can be able to function.
And that's what you live on to date?
Yes.
So what are the other options, treatment options out there?
Treatment option can be classified into whether it's acute or chronic. So acutely, meaning the infection is recent. So we have to be able to have our healthcare workers that are trained to be aware, to identify this earlier on so that we don't have these problems coming in later in life. Prescribing the right antibiotics for the right duration, for the right indication, earlier on. So later on, if the valves are damaged, now we are thinking about what can we do about this. But for you to identify the valves being damaged, and part of the treatment is for you to make the right diagnosis. So there's a test that is called an echo. He talked about it earlier. So this echo is just a scan, an ultrasound scan for the heart that looks at the valves. It's able to classify how severe the damage to the valve is. What type of damage? Is it leaking of blood, or is it narrowing of the valve? And then that determines whether you're going to go for surgery, or is it a wait and watch? Because if it's not too damaged, then you don't run and say you're going to have surgery for these patients. And surgery can either be we replace the valve, or if it's narrow, we dilate it to try and open it up.
All right, so Sam, we talked about treatment and there's a cost to it. You said going to the United States to get your surgery was a huge expense, but also there's the expense of managing the condition. Talk about that.
It was quite costly because I live in Trans Nzoia, that is my home area, and where the assistance was at Kenyatta Hospital, which is quite a distance. And again, we didn't have so many cardiologists at that time. In the course of time, we met these missionary nurses who are working at the Catholic Hospital in Kitale. And then they have organizations that assist children from developing countries to be treated abroad. And this was called Children's Heart Fund. So mine at that juncture only was to find the transportation.
To get there.
To get there.
Okay, but how has been the management? It has a cost to it.
You have to continue this blood thinner, and again you have to go for frequent INR to find out how much, because sometimes when you take too much of that warfarin, and then if the blood becomes too thin, anything, if you are injured, then you can overbleed. Because I don't know how it works, but it's like it prevents clotting. Yes. And that is the reason why you have to take, because of these foreign bodies, the valves. And it is quite costly, because it's something that you have to take for a lifetime.
Yes, yeah. Yes, it is. So, I mean, it's a lifelong condition. You've got to be on medication. Isn't this one of the deterrents to getting proper treatment?
He talked about going to the US, and I was smiling right here. Like, okay, fine, you know, this is so someone else is watching and they're thinking you have to go to the US. No, the treatment is available locally. We have cardiologists. I know the number is still not good enough. It's like one cardiologist to 1 million Kenyans. That is not acceptable. So we need to train more of our health workers, but the valve replacement surgery, valve replacement, valve repair is available locally. and I think locally it's more affordable. But maybe what we need to do is look for some private public partnerships where we are able to screen, identify, and replace early before we have the complications, which I think later on you want us to address, complications of rheumatic valvular heart disease, before they set in, so that we don't have a lot of deaths. And we need to do some patient drug access projects that patients are able to access medicine at a subsidized cost, or even the universal health coverage that we're talking about.
So are you saying NHIF doesn't cover this, insurance companies?
They cover at a certain level. I'm sure even he will mention that if you have NHIF, it only covers, let's say, I don't know, they're supposed to be rolling out ways to have everything covered, where you just walk in and walk out. But drugs, they can't get over the counter. They'll be told those you have to purchase. Unless you're admitted and you need some big procedure, you won't be able to get those drugs.
Rheumatic heart disease is clearly preventable. In your advocacy work, Sam, what should people keep in mind in as far as keeping it at bay?
We have formed an organization called Kenya Mended Hearts Patient Association. This is entirely to do with patients who have been treated, or guardians who have children suffering from heart diseases. And in that organization, we try to create awareness to those people who they don't know about the heart. Sometimes when one is diagnosed with a heart problem, they think now that is the end of the world. The death is next. But you try to encourage them, saying, okay, we are here, we have gone through this process. Of course, it is expensive. And that is, as an association, we are trying to reach out to government as we encourage one another that we can get assistance.
I'd like you to say this, to tell us in closing, the role of over-the-counter prescriptions and how it has fueled this condition.
We're getting a lot of resistance coming up of antimicrobials, especially bacterial infections. And we said our discussion for today, the origin was from getting a bacterial sore throat. And what will happen then? We'll start having sore throats that are not responding to antibiotic, or we are using drugs, we are misusing or abusing the antibiotics. And so what we'll do ultimately is fuel the development of rheumatic valvular or rheumatic heart disease. So it just means we are going to practice poor medicine for poor people, and eventually we have poor complications that can be handled by our poor health system.
Well said, Dr. Yubreen Mora, who is an internist, and Samuel Arab-Sang, living with rheumatic heart condition. Thank you for your time, and as you've heard, you have a lot to play in as far as keeping rheumatic heart disease at bay. Time now for the health tip.
With pregnant women, it's always advisable you open up your legs for you to be stable. So she's going to sit like this and then work on that bicep slowly, okay? She can do 8 to 10 reps. The other workout is this one, squat. You can call it sumo squat, goblet squat. So she's going down slowly and up, okay? Slowly down and up. There's another one also that you can do without the use of any weight or anything. So slight bend and then press 1, 2, 3, 4, 5, and 6. Good job.
Rheumatic heart disease, definitely lots of learning on a health diary today, and thank you for your conversations going on social media, and definitely your suggestions. Keep them coming through. My name is Gladys Gashanja, and we've been coming to you from the Radisson Blu Arboretum. Till next time, see you. And today we're coming to you from the Radisson Blu Arboretum. Is that how we're going to read?
In 3, 2, 1, go.